All right, every day we are finding out more about the deadly coronavirus, and every day we are also learning what we don't know. Here with a report from the front lines of this corona pandemic is emergency medicine physician Dr. Jonathan Baugh, Chief Medical Officer of Remote Health Solutions. Dr. Baugh, welcome to the program.
Good morning. Thanks for having me on, Greg.
All right, so we're seeing all kinds of experimental treatments out there, from nicotine patches that they're saying that nicotine may stop the spread of coronavirus inside the body. There was some evidence that smokers were having some immunity to all this. But then in another study, we're seeing that smokers are at most risk because many of them suffer from other health issues. The confusion surrounding all of this is just spelled out right there is staggering. As a medical professional, how do you wade through it all?
It really is pretty challenging right now because there is so much data coming out, and a lot of it is truly, rather than data, is anecdotal evidence. People are saying this has worked and that's worked, that's not worked. What I rely upon is really trusted sources, things like UpToDate and the CDC, who I know are giving us real data. And I try to read medical literature and try to look for studies that have good, identifiable statistics behind them.
All right, so Oxford, England, it's going to start clinical trials of some experimental treatments here, and they're specifically going to start human trials, which means if you are sick with COVID-19, you can take part in this. I'm a firm believer of if you're an individual and you want to try it, have at it. How important is a study like that at Oxford, and what's that like for the patient to be taking an experimental treatment?
Well, usually by the time it gets to a human trial, the risk to the patient is pretty low. We've already identified the fact that it is, in essence, safe. And so, but that data, that ability to be able to actually apply it into a real living patient with the disease and be able to do randomized trials, patients with and patients without the new treatment who have the same disease, and try to figure out the confounding factors in there, is what science is all about. It's what medicine is about, and it's how we move forward without a doubt. We can see evidence of other treatments that have worked in the test tubes in labs and then don't pan out into real human trials. And those really don't do us any good. They're great knowledge, but they don't help us to treat the disease. But in this situation, the Oxford study is one of the ones that we're looking forward to.
All right, so when we're talking about vaccines for all of this, there's some reports by maybe fall of 2020 we could have some promising vaccines. When it comes to COVID-19, and I don't even know if we know enough about COVID-19 to answer this question, but every year we have a different strain of the flu. We do know that COVID-19 has the ability to morph itself. It went from animal to human transmission. Once we get a vaccine, that doesn't even really mean we're out of the woods, certainly a help, but where does that put us?
And not yet do we know. And you bring up a great point. The flu is a little bit different because it has so many variations already out there. And so when we come up with a vaccine for the flu season every year, we're taking from these hundreds of strains out there, and we're trying to assume the ones that are going to be prevalent in the fall. And we use those as the vaccine base. And sometimes we're right, sometimes we're not. Now, it's different with the COVID-19 because we know the base virus. We know where it is. We know what it's structured like at this point. And so even if it does mutate, we're hoping that the mutations are subtle enough that we can still use that same vaccine. Now, we know that that same vaccine won't be effective if it's a new virus, if it's a new COVID virus, if it's a new coronavirus, but we're hoping this COVID-19 will continue to be consistent enough that we can use that. As far as this fall, we hope. We do have a couple of trials going right now in human trials. We've got the one in Europe, and we've got 3 here that are actually in human trials. Could it be this fall? I think that's probably a little bit early to be able to say that it'll actually be out on the market. I'm saying probably 2021.
All right, well, can't come soon enough, that's for sure. Dr. Jonathan Baugh, thank you so much for what you do and keeping people safe out there.